After the Danish royal couple's two-day visit to Sweden, we wondered about the state of health of Queen Mary's consort after the release of her latest portraits. Queen Mary has been trending in recent days following her first state trip as monarch, the magnificent appearance in which the Australian met with her Swedish counterparts and Crown Princess Victoria and Daniel. The gestures in communication with her husband Frederick and the important jewelry she received during a gala dinner hosted at Stockholm Palace are just some of the topics that made Mary hit the headlines. However, in addition to these variables, another important detail about daughter-in-law of Margaret II has come to light, related to her current state of health. One only has to zoom in on photos taken at different times during the Danish King and Queen's visit to Sweden to realize that the Queen now has a small red spot in one of Mary's eyes, namely the left one. Although the makeup may be distracting, a small bleeding from the eyes, clearly visible, which is the result of a subconjunctival hemorrhage known colloquially as an effusion. This sign, which appears on the sclera of the eye, is very alarming to the naked eye because of the contrast between the red and white color of the eye. However, this condition is not painful to the patient and doesn't cause any discomfort. It is worth clarifying that they are benign, do not cause other vision problems, and usually appear without prior trauma. It can be hypothesized that Mary may be going through a period of stress or anxiety. However, this has not been proven, so we can only wait for the eye trauma to pause and for her eyes to look as normal as Mary decided to normalize this eye problem. Just as Sylvia from Sweden did, although in his case it was not due to work strain but rather due to hypothermia of the eyes. These currents can be particularly noticeable in the coldest months when the temperature difference between outside and inside is great, they told an international newspaper after speaking to the head of the court's information department. After a few very difficult months, it seems that stress has played havoc with Mary after more than 12 weeks in command. She returned to work with a stroke in the area of the sclera, that is the white part of the eye. Although it usually disappears after only 2 or 3 weeks, in certain cases it is advisable to visit a specialist and above all to maintain eye hygiene.